Hello everyone, welcome to the classroom. Today, I am going to introduce to you the commonly encountered medications used during an emergency. Are you familiar with the medications in the crash cart or resuscitation trolley? It is important for us to know what are the medications available, their indications, and how we use them. Here listed are the common resuscitation medications available in the crash trolley. We will go through all the 15 medications shown. This video is the first part of the series. Stay tuned for videos coming up explaining the rest. The first drug that we are going to talk about is adrenaline. Adrenaline is sympathomimetic catecholamine. It comes in a 1 ml solution in a single-use clear glass vial. It is used in emergencies such as cardiac arrest and anaphylaxis. In cardiac arrest, adrenaline is rapidly administered intravenously with the dose of 1 mg every 3 to 5 minutes. In anaphylaxis, adrenaline can be given intramuscularly with the dose of 0.3 to 0.5 mg, whereas in shock, adrenaline can be administered by continuous infusion with initial dose of 1 microgram per minute and titrated to the desired hemodynamic response. Next, amiodarone. It is known as an anti-arrhythmic drug used to treat atrial fibrillation, supraventricular tachycardia, pulseless ventricular fibrillation and pulseless ventricular tachycardia. In pulseless ventricular arrhythmia, amiodarone is given as IV push 300 mg after the third defibrillation. In unstable arrhythmia, 300 mg of amiodarone can be given over 15 to 30 minutes after synchronized cardioversion. In stable tachycardia, 300 mg of amiodarone can be given over 30 to 60 minutes, followed by 600 mg maintenance over 24 hours. Please note that amiodarone is incompatible with saline and should be administered solely in dextrose solution. Adenosine is used to convert supraventricular tachycardia to sinus rhythm after failed attempt of Valsalva maneuver. When injected into the body, adenosine is rapidly absorbed by red blood cells and endothelial cells and metabolized for natural uses throughout the body. Therefore, adenosine should be administered by rapid intravenous bolus so that a significant bolus of adenosine reaches the heart before it is metabolized. If the patient has a IV granula placed at the cubital fossa, the patient's arm should be swiftly lifted after administration of adenosine and saline to ensure drug delivery. The first dose of adenosine should be 6 mg administered over 1 to 3 seconds. If the rhythm does not convert out of SVT within 1 to 2 minutes, a second 12 mg dose may be given. This 12 mg dose may be repeated a second time if required. Please note that adenosine is strongly contraindicated in patients with bronchospasm such as bronchial asthma. Atropine is an antimuscarinic agent. It can be used in bradycardia such as patients with heart block. It also serves as an antidote for organophosphate poisoning. The dosing for atropine is 0.5 mg IV every 3 to 5 minutes as needed, and the maximum total dosage for administration is 3 mg. Atropine should be avoided in bradycardia caused by hypothermia and myocardial infarction because it increases oxygen demand and may worsen ischemia. In most cases, it will not be effective for second-degree block type 2 or complete heart block. In organophosphate poisoning, 2 to 5 mg of atropine is given followed by infusion. Verapamil is a calcium channel blocker. It is used to treat supraventricular tachycardia if adenosine is contraindicated. It is also helpful in atrial fibrillation and atrial flutter. It can be given in 2.5 to 5 mg as slow bolus over 5 minutes. Verapamil is contraindicated in cardiogenic shock, patients with low blood pressure and heart block. Lignocaine is considered as an alternative for ventricular arrhythmias if amiodarone is ineffective or not available. It can be given initially with the dose of 1 to 1.5 mg per kilogram intravenously, with an additional of 0.5 to 0.75 mg per kilogram, repeat in 5 to 10 minutes up to a maximum dose of 3 mg per kilogram. In stable ventricular tachycardia, we may start with a lower dose and repeat every 5 to 10 minutes up to a maximum of 3 mg per kilogram. That is it for today. Do consider to go through the materials again and try to fill in this table. Thank you for staying until the end. If you find this video helpful, do not forget to click the like button and share it. See you in the next video for the subsequent parts of this series on emergency medications. Have a great week.